Dr. Lillian Schapiro, and welcome to my YouTube channel. The day that I am recording this is in July, and July is Fibroid Awareness Month. However, here at Ideal Gynecology, every day is Fibroid Awareness Month. About 80% of women, it is estimated, may have fibroids. Some women suffer from fibroids, and some women, they don't bother them at all. Fibroids are generally described as a growth of the uterine muscle, and we name them according to where they are. And where they are can influence how much trouble they cause. The first type of fibroid I want to talk about is called submucosal. So a submucosal fibroid is in the lining of the uterus. The beautiful thing about the lining of the uterus is that we can often get to it without surgery, and we can go in through the vagina without making any incisions on your abdomen. The next type of fibroid is called intramural. So intramural literally means in the wall. And the wall is the uterus made up of muscle. And fibroids are overgrowth of the muscle tissue. So as the fibroid grows, it can become more and more troublesome. Another type of fibroid is called subserosal. So the uterus has a lining on the outside of it, and that lining is called the serosa, and a subserosal fibroid is right under that lining. The fourth type of fibroid is called a pedunculated fibroid. So that means it's on a pedicle or hanging on a stalk. So it can be hanging on the stalk on the outside of the uterus, kind of flapping around in your abdominal cavity or in your pelvis, or it can actually be pedunculated inside of the cavity. Fibroids, as I said, can cause many symptoms. They can cause heavy bleeding. They can cause bleeding with intercourse. They can cause terrible periods. They can cause irregular bleeding, and they can cause pressure and pain. Fibroids can be very tiny, tinier than a small marble, and fibroids can grow to fill up your whole cavity. I've had patients whose fibroid went all the way up to below their rib cage. We're very good at diagnosing fibroids. The way to tell if you have a fibroid is with an ultrasound, and sometimes in addition to an ultrasound, we'll need to do something called a sonohysterogram or a hysterosalpingogram, that's the same thing, where we inject saline into the lining of the uterus to see if there's a fibroid right in there inside the lining. A big and actually very controversial question is whether fibroids become cancerous. We used to think that only about 1 in 1,000 became cancerous, and now we think it's closer to 1 in 300. So if you think you might have fibroids, please give us a call here at Ideal Gynecology. Myself and my nurse practitioners are very happy to talk to you about what your options are. You will probably feel much, much better after you take care of your fibroids. I hope you enjoyed this video. I love educating people, and YouTube is just a great way to do that. If you enjoyed this video, I hope you'll hit the subscribe button and also the bell so you'll be alerted every time that I publish a new video.